Good morning. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us for another segment. Going to be having a conversation with Mr. Rich Birhanzel. He's Senior Managing Director at Accenture, and he's joining us to talk about a recent report that Accenture released. Welcome to the program, Rich. Thanks for joining us.
Thank you for the opportunity.
Well, give our listeners a little bit about yourself, about your role there at Accenture, and then let's talk about this recently released report.
So I lead the global health team here at Accenture, and have spent my entire career here working with our health plan and provider clients across the globe. We have taken a keen interest in this subject of behavioral health as the conditions have changed during the crises that we're all experiencing. Notably around COVID and some of the distancing that's been required in the way we treat people who have needs both in telemedicine, but also in the telemental space. So we took a keen interest toward this subject. We were curious about what was happening in the way people were receiving care in this important space of behavioral health. And we launched a consumer study a couple of months ago to get a real fresh and current view in the United States around how people were accessing care and what their attitudes were toward the types of access they might consider. Ultimately, we were trying to sort out, with this movement toward virtual care that's become a necessity during COVID, have some sustainability to it. Would that be a preferred way to get care in the future when we have moved past the impacts of this particular pandemic?
Is behavioral health separate from mental health? Is it an extension of mental health? Is there a difference?
So we took a broad view of behavioral health. We think about it as the promotion of emotional, social, and psychological resilience and well-being, and the treatment of mental and substance abuse disorders. So we took a broad view, including disorder and substance abuse, so that we could get the full picture.
Now, this report is entitled Breakthrough Behavioral Health Access, Think Virtual. It finds that the use of this virtual delivery channels could expand treatment, as you say, to millions. Talk about this research and give us the major takeaways that we should consider.
So what we've learned as we conducted the research is that approximately 65 million Americans have mental health and substance abuse conditions today. But what we also learned is a good number of those aren't receiving the treatment that they need. In fact, only 43% are receiving treatment that they need for the challenges that they face. There's a number of reasons for that. There's access issues, there's cost issues. Sometimes there's stigma involved in this, in seeking this sort of treatment. But the thing we focused in on here was access. So if we could, could there be a way for access to be improved so that we can see more care delivered to the people who need it in the United States? There are a couple of access points that are particularly concerning. First is the average wait time for a first appointment is around 25 days. That's quite a long time, as you might imagine, for someone who is in distress. Furthermore, as we look forward toward 2025, over the next few years, by that time, there could be a shortage of health professionals to treat behavioral health issues by as much as 250,000. So we're facing the potential for a real shortage of professionals who can treat these issues, and we already have constraints on the access as indicated by the wait time. Now, what's happened during COVID is there's been a bit of a change in terms of how people can access that care. We've gone from fairly moderate use of virtual channels, web chat, telephonic, other forms of even chat, just regular chat, other forms of engagement was nominal pre-COVID, but now has become more of a standard just out of necessity because of the requirements around social distancing. And so what we were looking to find is, would people be amenable to those alternative channels. And what we found is that 81% have a willingness and an interest to explore that channel. And so when we think about it, we have the potential to really change how many people have access to care by leveraging virtual channels. We as a society have that opportunity. And now with these virtual channels, what we discovered is that people are amenable to those channels. They're interested in looking at those. It also breaks down in a demographic way too that is particularly important. The two generational groups that are most interested in virtual channels for behavioral care are millennials and the Gen Z population. So as we all know, millennials are now becoming the dominant force in our workforce, in the United States, and then the Gen Z population is right behind them. So that tells you that demand is only going to grow because those are the two that are driving the highest interest in these virtual channels.
You say it's going to grow. It's growing now, as you say, based on the current situation, this pandemic, this necessity for this growth. What about when and if this crisis passes? Will we continue to embrace this technology, this hands-off type of access?
That's a great question, and that's we looked to study that as well. So our perspective is that the people that are seeking the care, they have that propensity. That's really what we're asking about is beyond the crisis, beyond the current moments that we're in, would they consider those channels in the future? And that's what they told us. 4 out of 5 said they would. However, there are 3 things that we have to get right for that to be true, and I'll share those with you here as well. And we learned this, in feedback from these folks that we talked to. The first is we have to control the personal cost. What that means is we can't be loading off significant incremental cost to the person to use a virtual channel. It has to be neutral to other ways of getting care, including the in-person approach. So those in the ecosystem that are going to provide these services, insurers and providers and governments have to make those services cost neutral to the person receiving the services in a virtual way. Mm-hmm. The second is this concept of orbit around experience. What that really means is that we have to get the experience around virtual care, particularly for behavioral care. We have to get that right, not just right for the person, but also for the provider, the person that's providing the care. When we think about the person, these are things like we have to have options. Sometimes in behavioral health, anonymity is particularly important to the individual. So there are utilities that can be deployed like avatars or other ways to shield identity while there's a receipt of care. We have to make that easy for people to activate, easy to use. We have to also think about the provider experience, think about how they. So it's something more than just a communication through a video chat. There has to be some enablement around, data and analytics and workflow so that the provider also has an experience that they have some affinity toward. So that's the second thing is really focus in on making that experience something that people want to participate in, not just a source of convenience. And then the third thing is making a broader connection. So what that means is, behavioral health is just a component of someone's life, and it's even just a component oftentimes of their health care. We know that folks that have behavioral challenges that they're seeking treatment for, they are oftentimes they also have medical issues or other things that they're seeking treatment for, in their broader life. And there's an opportunity to connect behavioral health with physical health, and that's something that this virtual environment really could unlock the potential around. So thinking about this holistically, we think about it as a whole person approach, not just these episodes of therapy or of treatment, but also thinking about it more holistically and understanding the whole person.
Breakthrough Behavioral Health Access. Think virtual. We'd like to learn more about Accenture and about this report as well. Where can we go online?
www.accenture.com.
Well, I appreciate you joining us here on Health Professional Radio this morning, and I'm hoping we'll speak again.
Thank you so much. Really appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Mr. Rich Birhanzel, Senior Managing Director at Accenture. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.